Ya me dieron algunas cositas aquí para lo de la cirugía y esperando que ella venga a hablar de la cirugía, pero yo los voy a mantener diciéndole qué es lo que está para pasar. Después, aproximadamente ya me dijeron que el proceso es de 6 a 9 meses.
You can just click this. They will check you for the smoking because of the history of smoking. The insurance may come back later and say they want a tox screen. Some of them do. So you would just come in and get that. That's a urine test. And then she may order some labs for you and things like that. Let's check her A1C actually. Go into chart review. And then go to lab. And then A1C. All the appointments that Dr. Dorsey says you need.
Okay.
Dr. Dorsey will go over both of the surgeries with you. She'll explain both of them. Were you leaning towards one or the other?
I'm not, whatever she
thinks.
Yeah,
okay, good.
That's the best.
It's good to keep an open mind.
Mm-hmm.
You will need that EGD though for sure. She needs to know what's going on. If you have any hernias or anything down there, she would check that out. Just keep clicking all the way negative. What else? Basically, it takes like 6 to 9 months to get out. Okay, let's look and see what she's on. Albuterol, which is for Zithromax, Wellbutrin.
There's a lot of pills there if I'm not drinking.
That you're not taking?
A lot. I'm drinking ibuprofen and the one for the smoking.
Okay.
And that's it.
Okay.
Nothing else.
The one for the smoking?
Yeah, it's like a purple pill. I don't remember the name of it.
Is it the Wellbutrin?
It's for anxiety too.
Anxiety.
Yeah. Okay, that one. It help you.
All right, that's okay. Just click, go down to the end and click. So, let's not forget Dr. Dorsey does the review of systems. So let's go to the review of systems. Do you have any skin problems at all? Anything with your skin, eyes, ears, nothing?
No.
Heart,
Pretty
lungs.
healthy.
Okay, so just go through and start clicking all of that. Have you ever tried to commit suicide, or do you have psychological problems? Okay. Good. So we have a navigator. Her name is Michelle. She'll navigate you through the. Okay.
So how many times are you gonna be seeing me here before the surgery?
Not many. So I see you today.
So the appointments is like
They just happen.
okay.
Yeah. So Michelle is our navigator. She helps you get all your appointments and get set up. You'll see weight management. You'll see the pulmonary, the lung doctor.
I already got a few appointments.
So you keep doing all that. You'll see me for your endoscopy, and then the next time you see me is for your pre-surgery appointment.
All right.
Let's rock and roll.
Yes.
All right, you got this. All right, my dear.
Thank you.
Good job. Keep up the great work. And then let me get you my card in case you need it. As the bypass, meaning you don't lose quite as much weight, but it's still very good. Okay. Also for diabetes. So some patients are diabetic and they're on insulin. They're, hard to control. They've been very diabetic for a long time. For those people, the bypass can actually cure their diabetes. The sleeve would help their diabetes, but it's not quite as powerful. You're not in that boat. You have diabetes that's pretty much controlled just with diet.
Yeah.
You're not on any medications, so I would still expect that to be reversed and cured with either operation. Okay? So it's less powerful for weight loss, for some people for diabetes, and it can increase acid reflux. Now you don't have much reflux, so I wouldn't expect that for you. In people who tell me, oh, my reflux is so bad, I have heartburn all the time, I'm on all these medications,
Okay.
that wouldn't be good. Okay?
All right.
So those are kind of the pros and cons. Now if we talk about expected weight loss, your pre-op weight is 241 with a body mass index of 44. We calculate your ideal body weight based off of a body mass index of 27. And for your height, that would be 147 pounds. That's not what we're going to get to. That's just what helps me figure out how much extra weight you're carrying.
Right.
So your excess weight is 101 pounds. With this surgery, you lose about 55 to 60% of that excess weight. So you would lose 55 to 60 pounds with surgery alone. Now, as you do diet and lifestyle changes, you could lose even more. So, you know, as you're doing eating right and doing activities, you could probably end up in the 160 range or so. Okay.
Right, because I don't want to see me skinny like I'm
not too skinny. Yeah, no, I understand. But our goal is to get you kind of to a healthier range and get some of that extra weight off. Okay.
Sounds good.
Questions here?
I mean, no.
I think you're an excellent candidate for this one, the sleeve, but I'm still going to tell you about the bypass just so you're well informed. Okay. All right. Good. And then I know Beth already talked to you about the quitting smoking as well.
Oh, yes.
So quitting smoking is very important. Once you quit fully, 6 weeks after quitting smoking, we get a blood test or a urine test that shows us that all the nicotine has cleared from your body, okay? So it's called a cotinine test.
I'm working on it.
Perfect. You're doing great. Good job. New year, new you.
Yes,
Let's do it.
Yes.
All right, so here's the gastric bypass. Now, once again, I don't think you need this. I just want you to know about it, okay? So I'm still starting with a normal kind of football-shaped stomach. But what I do is I create a small little egg-shaped stomach. I then hook that small egg-shaped stomach directly up to the small intestine. So when you eat, it goes down your esophagus, through this little tiny stomach, and then into the intestine, okay? The rest of the stomach is still there, it's just bypassed. It's not seeing any food, okay? So this part still makes its little digestive juices. No gallbladder, you don't have that. So food is here, juices that break down the food are here. Then there's a new connection I have to make here to where they can both meet up. So you have food plus the liquids that break down the food in the same place. So you can tell it's much more complex.
Yeah.
Rerouting intestines, two new connections, all of that.
It sounds scary though.
Yeah, so, and you don't need it. Meaning, you don't have that large of amount of excess weight, you don't have bad diabetes, you don't have bad reflux, you don't have the reasons for me to say, oh, we need to take the extra risk for the bypass. Okay? So that's what it is. In terms of expected weight, you do lose a little bit more weight with a bypass. So you lose about 70 pounds instead of 50 to 60, but that's only a 10-pound difference for you. So the risk is worth it for that little bit of extra weight. Okay? So I would recommend the sleeve for you. I think it's a perfect option, and I think you would do really well with it.
Well, you're the doctor.
Yeah.
Yeah, that's fine.
Yeah. Questions or concerns?
I mean, well, not really. I mean, I've been reading and, you know, all that, and I don't know, I'm ready.
I know. I'm ready to help you, so let's do it, okay?